Hi, everyone. My name is Asha Creary, and I am back with another Post-Grad with Asha NCE edition. I am a licensed professional counselor in the state of Texas and a licensed professional counselor approved supervisor in the state of Missouri. In this episode of Post-Grad with Asha, we will focus on Section 3 of the NCE. We will not discuss questions just yet. That will be in our follow-up video. The third domain of the NCE covers areas of clinical focus. It is 29% of the test and will have 47 scored items. This section encompasses counselors' knowledge and skills related to the areas of client concerns. So, 29%, 47 scored questions. This is the largest section, I believe, of the NCE subsections. So what that means is it's going to be a lot of information. So sit tight, buckle down as we start to navigate through the subsections of Section 3. So adjustment related to physical loss, injury, or medical condition. So what that means is that you should be aware of the different types of adjustments a person can experience, not just including physical, but adjustments to new mental health diagnosis, terminal illnesses, and more. The clinician should be versed in the grief cycle and be versed in rehabilitative options and coping skills available to clients. Aging and geriatric concerns. These could include fear of death, loss of abilities, workplace discrimination, being treated disabled, or like they are elderly, physical challenges, potential change in memory-related issues. So what this means is, as you're taking your test, think about the older population that you've worked with in the past and some of the common issues of concern that has been discussed. Other things to consider is, of course, the grief cycle, spirituality concerns, end-of-life planning, other things like that. The next thing is behavioral concerns. So when taking the test, be mindful of the best tools in behavioral related interventions that can support your clients. Be able to identify triggers, barriers to managing behaviors, familial and educational related accommodations or interventions that may be needed, and when there is a potential need for the integration of a BCBA or a prescribing provider as it relates to behavioral problems. Other things to remember is identifying behavioral related diagnosis in the DSM. The next up is bullying. So on the test, you may receive questions related to the effects of bullying and being a bully. So what that means is you may have a question about someone who has experienced bullying, the effects that it has on their mental health, issues that they're having with coping, even behaviors following being bullied, such as self-harming, SI, and other aggressive or maladaptive coping mechanisms. You may see students who have experienced or is experiencing bullying, or even adults experiencing bullying. Now, when it comes to the latter, if you are working with a client who is the person doing the bullying, you need to be aware of how to support them in managing aggressive behaviors and managing coping skills, and probably information around cognitive behavioral interventions to support with changing cognitions, thoughts, and behaviors leading to being a bully. And then you may also be required to answer questions regarding ways to support your client and ways to implement changes so that they can no longer be bullies. The next up is caregiving concerns. On the test may want you to be aware of how to support your client in the integration of self-care and development of a support system or a set of systems to help alleviate the stress around being a caregiver. You may see questions around support, how to support a client through stress, how to support a client through resentment, how to support a client through grief, anxiety, and any other disorders, stressors, triggers related to being a caregiver. So again, think about your clients who have children. Think about your clients who are taking care of their elderly parents. Think about your clients who are taking care of disabled family members. Think about the issues and concerns that they would have being a caregiver. Next up is cultural adjustments. So you may have to support a client in adjusting to changes in cultural environments such as new cities, new workspaces, changes in community-related cultural adjustments. This could also include changes in environments and adapting to new and changing expectations within a culture. Next up is end-of-life issues. End-of-life issues on the test may show up in scenarios around the grief cycle, end-of-life planning, stress, fear, worry, spirituality, and more. Most times, these issues would include physical comfort, mental, emotional comfort, spiritual, and support with practical tasks. So again, end-of-life issues could be commingled with the geriatric and aging population of the test. Fear and panic. Clinicians should be prepared to support clients with somatic symptoms, thoughts, and emotions when fear and panic arise. They will need to know which modalities will be a great fit and how to safely support them if a panic attack arises. Financial issues. When taking your test, if you see a question that comes up around financial issues, remember, we are not financial advisors. So your goal is to review stress and other mental health related issues that arise due to the financial issues a client may be experiencing. You may have to support them with developing solutions to reducing debt or monitoring behaviors that lead to more debt. So you may be managing impulsivity in this section. You may be managing emotion-related spending. You may be working with a client who has people-pleasing spending habits, trying to buy their friends, trying to buy their loved ones, different things like that. So when you think about financial issues, don't think financial advisor helping them come up with a plan and devise a plan, but more so think about behaviors that your client may need the most support with when it comes to managing their own finances. And even goal setting, like you can still support a client in setting a goal to pay off a type of debt, or a small debt or a big debt, or whatever they choose to be working through in the moment. Gender identity development. So on your test, there will be questions that will align with gender identity development. If you have a bias, leave it out of responding to these questions. You should be aware of gender-related identity issues impacting their mental health, ways to cope with their identity if they would like to present differently than they do biologically. You would need to be aware of best language to use and support with coping skills that they may need as they continue to work through the development of their identity. The grief and loss is next. On the test, there may be questions around the grief cycle and identifying where your client is in the grief cycle. You may need to know the different types of grief and identifying treatment goals and treatment plans that most align with their needs around grief. The DSM-TR has recently added prolonged grief disorder. So minor awareness of this is important since it is a new diagnosis. Prolonged grief disorder was not in the DSM originally, so it may show up in some of the newer questions or the field questions on the DSM. Hopelessness and depression. Always remember, depression does not equal suicide. You may have a question that says a client is struggling with depression. What should you do next to assess their level of depression? And may provide you with a list of assessments or screeners. Do not necessarily select suicide screener unless a client says, or unless the question says that the client wishes they were dead, had thoughts of suicide, and there are trigger words in the question that warrant that. Also be aware of the different types of depression, including recurrent, chronic, single episode, mild, moderate, severe, and so forth. This will be important if they ask a diagnostic question related to depression. Loneliness and attachment. A question from this subsection may be around attachment styles, types, ways to cope, community development or developing community, and identifying client needs around attachment. It may also show up in relation to relationships and marriage and childhood trauma, and you may also see questions around family dynamics and birth order when it comes to attachment. Hypo mental focus. This may show up in a question related to ADHD and other disorders impacting mental focus. Clinicians should be prepared to identify the type of ADHD, symptoms of hyper versus hypo, attentive versus inattentive type, best coping skills, best treatment modality, and treatment goals that may best benefit the client. Intellectual functioning issues. There may be questions around the types of intellectual disabilities listed in the DSM-TR, learning, problem solving, judgment-related issues, communication, independent living, and mental age versus chronological age may be presented on your test. They may want you to be aware of the impacts this could have on someone in school or of working age in the workforce. Insomnia and sleep issues. Be aware of hypersomnia and hyposomnia, ability to review bedtime routines, incorporation of mindfulness activities, be aware of emotional states or diets impacting sleep, know when to refer to a physician for further testing, and be able to discuss time management or PTSD and anxiety-related issues impacting sleep. Maladaptive eating disorders. Maladaptive eating disorders could include binge eating, calorie counting, restrictive eating, and so forth. It may be coupled with intrusive thoughts, body dysmorphia, related issues, and so forth. Next up, remarriage and recommitment. You may be tasked with supporting a client in processing trauma, thought patterns, and old behaviors in relation to getting remarried, married, or reintegration into a previous relationship, and how to establish healthy relationships as they move into marriage or recommitment. This may include remarriage to a new person after a divorce, co-parenting, establishing trust, and more. Next up, developmental processes, tasks, and issues. When thinking about developmental processes, tasks, and issues, think about how a 3-year-old would carry out a task, how a 14-year-old would process relationship. What are some issues a person with developmental processing issues may have? Be aware of the developmental stages and psychosocial stages, psychosexual stages, developmental tasks and stages, and other developmental models around cognitive development, physical development, and social development. So be thinking Freud, Erikson, and any of the other founding fathers of psychotherapy theories around social, physical, and cognitive development. Obsessive thoughts and behaviors. Obsessive thoughts and behaviors may show up in a question related to OCD, but it could also show up in a question around anxiety, recurrent thoughts, or around recurrent impulsive behaviors. Obsessive thoughts and behaviors isn't just someone turning the lights on 3 times in a row before leaving a room. It could be a person with the obsession of death and dying, the obsession around the fear of losing a loved one. It could be the obsession of a person, a place, a thing, a food. It could also be recurrent behaviors in how you do certain things. Next up, occupational and career development. Occupational and career development questions may include an assessment or strength screener. It could include navigating career changes. It could include supporting someone through developing new skills to enhance their current role. It could include the emotional concerns around occupational and career development. Just think long-term career goals, short-term career goals, and be aware of the 5 career stages, including exploration, establishment, mid-career, late career, decline, and new trends in career development, as we saw with COVID-19. Physical issues related to anxiety is up next. So you may have heard me mention somatic symptoms. Somatic symptoms, if you are not aware of that term, are physical symptoms a person may be experiencing that are not quite presenting to someone who's looking at them. So physical issues related to anxiety could include stomach aches, tension, increased heart rate, breathing difficulties, sweating, changes in body temperature, trembles, and more. Review the DSM on anxiety and physical symptoms related to anxiety. Now, if you feel like the DSM doesn't encompass a totality of what somatic symptoms a person could be experiencing, don't forget, you can always get on Google and Google somatic symptoms related to anxiety. That could include more than what I just listed, such as headaches. It could also include other things that could lead to someone being hospitalized as well. Don't go in a rabbit hole with that. Just know enough to be able to answer a question around anxiety. You may also need to know how to actually treat these somatic symptoms, relative psychotherapy related techniques that you can utilize to treat these issues. You may also need to be aware of cognitive behavioral processes or CBT processes that could support a client through anxiety-related symptoms, also including mindfulness-related CBT activities. Next up, physical issues related to depression. The physical issues could include fatigue, chronic pain, weight gain, weight loss, inflammation, constipation, headaches, nausea, onset of heart disease, and so forth. Again, review the DSM on depression and physical symptoms related to depression. Next up, physical and emotional issues related to trauma. These may include a mixture of anxiety-related physical symptoms and depression-related physical symptoms and increased adrenaline. These issues can include fear, worry, impaired fight, flight, freeze, fawn responses, impaired perceptions, and more. So again, your job is to support in identifying physical symptoms that may be related to trauma for a client that shows up on the examination. Next up, processing addictions, including pornography, gambling, spending, substance use, anything you can think of that could be considered an addiction in the DSM, think about that. Sex addiction, all of that. This will be another section, again, to review in the DSM on the information that it has around best practices for working with clients with addiction-related issues. You should be able to support with identifying the root causes of addiction, processing triggers and emotions related to or leading to maladaptive behaviors. Be aware on how to implement coping skills and processing barriers to implementation of coping skills for clients struggling with addiction. Other things to remember is to be aware of the telltale signs that someone has an addiction, more so in relation to substance use and more so in relation to changes in behaviors following an addiction that is, how can I explain it? Following an addiction that is taking a client down, meaning the client has used all their funds, the client has stolen, cheated, lied, all the things in relation to said addiction. Next up is racism, discrimination, and oppression. This is another area where you would need to check your bias regardless of what side of the fence, gender, or skin tone you fall on. This will be around systemic issues, generational issues, fears, internal beliefs about people and people's interactions in the world. You may have to support a client in developing self-advocacy skills and more. Also, remember that in this particular section, your job is to support a client in identifying how racism, discrimination, and oppression impacts their world, regardless of what you believe to be true. You're also going to be doing this from a lens of the data that is out there and what best practices are out there in relation to supporting clients who are experiencing issues with racism, discrimination, and oppression. And also remember, as you're reading through the question, do not, I repeat, do not dismiss the client's concerns in the test question. If you dismiss the client's concerns in the test question, you're more than likely going to miss the questions. Next up, religious values and conflicts. This usually comes up for those who recently went through something traumatic, processing old religious-related abuse, or someone who is in the process of questioning their faith. Although you may not be a religious counselor, your role would be to help them navigate through the internal conflict they may be having. So you don't necessarily need to be aware of the religion itself, such as like Christianity, Catholicism, being a Muslim, or anything like that. You more so need to know how to support somebody through maybe Socratic questioning or something of the nature as they deal with cognitive dissonance in relation to religious beliefs. And you may also need to be aware of how to support a client who is struggling with internal conflict with the higher power. Regardless of what your beliefs are, that is something you need to be aware of. All right, next up, retirement concerns. Retirement concerns may include supporting a client in finding new purpose, financial planning, developing a routine, grief, and other retirement-related issues. This may also be coupled with a question around the aging geriatric population and questions around end-of-life issues. This may pop up there. Next up is ruminating or intrusive thoughts. Ruminating or intrusive thoughts are different things that can be related to anxiety issues or trauma-related issues. Ruminating thoughts are usually recurring thoughts that don't lead to new thoughts, or they don't change at all. So all or nothing thinking, rigid thought patterns. Intrusive thoughts are thoughts that are typically disturbing in nature, usually related to trauma. So your clients that are struggling with PTSD, they typically deal with intrusive thoughts. Someone who's experienced being cheated on, someone who's experienced a car accident, someone who went through sexual assault, anything like that, you're going to be thinking about recurrent versus intrusive thoughts and being able to identify the difference between the two. Next up, separation from primary caregivers. So this question may show up as a parent struggling with a child with a maladaptive coping style, or it may show up as a child struggling with their attachment to their parents, their friends, or items. This could also show up for families going through transitions like divorce, graduation, marriage, and more. Anxiety and depression, or anxiety, depression, and attachment-related disorders can show up in this section as well, or underneath this stem. Sexual functioning issues may include issues related to disabilities, related to sexual trauma, related to pain, related to libido or hormone-related issues. It may be related to body image issues and more. So think pain disorders, arousal disorders, orgasm disorders, and desire disorders, in addition to trauma-related issues. Sleeping habits. Sleeping habits can include bedtime routines, intermittent sleeping patterns, difficulty going to sleep, difficulty getting out of bed, daily routines, work schedules, impacting sleep patterns, and so forth. Next up, spiritual and existential concerns. Some would lump spirituality with religious-related concerns, but they are not the same. Religion is related to the practice of a religious ideal or belief. Spiritual and existential world focuses on the here and now, how we feel we exist in relation to the universe, beliefs about life after, and current spiritual existential habits and beliefs. Stress management is the next piece. Stress management skills may show up in this subsection. Skills could include time management support, setting boundaries with time or others, not taking on more than they should, incorporating self-care practices and routines, changes in workplace environments, changes in family dynamics, financial related stress, and again, since it's titled stress management, you're going to want to know, how can I support a client in managing their stress, whatever the stress is. Next up is substance use and addiction issues. So you heard me talk about addiction a little bit earlier in relation to substance use, just a teeny bit. But in this particular question, you're going to want to review the DSM to review the different types of substance-induced disorders, in addition to substance use issues. Some clients have mental health related issues because of substance-induced reasons. For example, a client may be experiencing hallucinations and recurrent hallucinations, even though they are not actively under the influence of a drug. So that may be considered a substance-induced disorder of some sort. So being aware of that in the DSM. Next up, suicidal thoughts and behaviors. So as I mentioned before, depression doesn't equal suicide. But if a client does mention that they have thoughts, plans, intents, or if you hear the trigger words, I don't want to be here anymore, I'm giving away all of my things, I just don't have the motivation, I don't know why I'm here anymore, you start hearing those trigger words, that's where this starts to come up on the exam. Suicidal thoughts and behavior questions may include questions around self-harming behaviors. Testers should know about safety plans, how to manage a crisis, knowing when to refer for additional support, and you should also be aware of the limitations of confidentiality on a question related to suicidal related issues. Terminal illness issues. Terminal illness issues can lead to depression, anxiety, grief, and so much more. Knowing how to support someone in navigating end-of-life issues, changes in abilities, and navigating family systems is important. Visual, auditory hallucinations is the next section. Knowing how to assess for visual and auditory hallucinations is important. Sometimes we are tasked with supporting them in managing the voices and identifying ways to cope with them, and supporting them with navigating the voices in public spaces. Sometimes we work collaboratively with other healthcare professionals to support clients struggling with hallucinations, but also remember, you work with whoever shows up during the session. And so if you have a client who has auditory or visual hallucinations, or it could also show up in some DID related, dissociative identity related disorders, you may see some of that here, even though that's not necessarily this subsection, but some would lump it together on the exam. Worry and anxiety. On the test, you may be tasked with identifying the best modality, best coping strategies, treatment plans, and ways to manage and reduce triggers leading to worry and anxiety. Next up, adoption issues. So adoption issues can be questions on working with families seeking adoption, working with children during or post-adoption, or children in foster care, and working through the adoption process as a whole. Next up, blended family issues. So the biggest thing is to know what a blended family is. Of course, a blended family could be single mom and a single dad getting married and now their families are blended. It could be a family taking in other family members like a niece or a nephew. It could be things of that nature. So think about that. But these can include also outside co-parenting parties that impact the family dynamics. This can include new in-law dynamics and so forth. There are usually stress-related concerns, conflict in interpersonal relationships, and blending issues showing up in this particular subsection. Child abuse-related concerns. Child abuse-related concerns could be questions around a parent with abusive tendencies, children recovering from abusive parents, or families with abusive siblings. But also remember the limits of confidentiality when it comes to supporting children and family with abuse-related concerns. Now that may more so show up in the previous section or section 2 of the NCE, but you never know when that may be coupled with a question around child abuse-related concerns. Next up, child development issues. On the test, you may need to be aware of child development in infancy years, toddler, adolescent, and young adult years. Child development issues can include social, emotional, cognitive, physical, learning, and so much more. So again, review the DSM as it will help you best understand how to answer or identify child development related issues. Next up, dating and relationship problems. Dating and relationship problems may have questions around maladaptive behaviors, attachment issues, trust-related issues, finances, becoming one, family planning, and more. So when you think dating and relationships, if you are in your young adult years, or even if you are, an older person, think about the issues that you're having in the dating space. And think about those clients that you have that are having issues in the dating space and having issues with maintaining relationships and different things like that. And some of those things can show up on the test in a scenario-based question. So think about how you would support them. Think about what you would need. Think about changes you would need to make in a relationship in order for it to work, or boundaries you need to put in place, or attachment issues. Think all of that when you are thinking about dating relationship-related problems on the exam. Next up, divorce. So this may include stress related to separation, developing a sense of self, navigating parenting plans, conflict resolution, financial planning, working through divorce processes. You may have to be able to support with coping skills, family planning, and more. Also, when it comes to divorce, be thinking about coping skills, managing emotions, and implementing coping skills in addition to the impacts that divorce can have on children. Feelings of guilt, stress, diminishing in grades, increase in maladaptive behaviors such as aggression, such as addiction, such as risky behaviors, different things like that. Family abuse and violence. So this will include physical, sexual, emotional, and although neglect isn't necessarily here, you may have to consider neglect on the test. So be aware of mandatory reporting rules, be able to identify the different types of abuse and ways to help manage maladaptive behaviors related to abuse, whether it's someone who is the one being abused or the one who is doing the abusing. Support in changing cognitions and thoughts that impact experiences with abuse and violence. So when I mentioned ways to manage maladaptive behaviors for a person who is being abused and a person who is doing the abusing, you want to think about how do you support a client who keeps going back to someone who is abusive to them? Or how do you support a client who is experiencing abuse from a parent and how to reintegrate them into the family dynamics? How to implement coping skills, how to do set boundaries, how to avoid conflict with an abuser, and different things like that. Interpersonal partner violence concerns. So this may include questions around teen dating violence, safety plans for a person needing to exit, developing and increasing self-worth with a client, discussing fears and any other mental health related issues as it shows up in relation to interpersonal partner violence concerns. Marital and partner communication problems. This may be in inclusion to working with couples on trust-based communication, integration of assertive communication versus passive communication, transparency, fair fighting rules, creating safe spaces for communication, and more. You may have to include insight on treatment goals and plans around communication related corrective or adaptive behaviors. Next up, parenting and co-parenting conflicts. The test may require you to be able to support families in mediation, working through toxic communication, supporting children through disagreements between parents, and more. Parenting and co-parenting conflict may also include stress, anxiety, depression, hopelessness, and other things you could think of when it comes to navigating co-parenting and parenting conflict, in addition to the stress around being a caregiver to a child or a caregiver to a child. Next up, emotional dysregulation. On the exam, well, this is actually the final subsection. So on the exam, you may be tasked with supporting clients with grounding clients, identifying triggers leading to emotional dysregulation, supporting clients with developing coping skills, and you may need to know when to refer a client out for additional assessments. And you'll also want to know emotion-related mental health disorders and different diagnoses this particular concern will show up for clients. So that's it for domain 3 of the NCE breakdown. Sorry for the intense sunlight. I just wanted to do the video out on my porch. Then it got hot, but hey, here we are. So again, this is the biggest part on the NCE exam. Be thinking about these different things. And again, a lot of this is self-explanatory. If you are human, you've seen all of these problems in your life. You've also seen these problems in your practicum and internship experiences. And if you have not, you probably should have had a different practicum site. If you're still in school and you're still in practicum and you're not getting experience with a variation of these issues, you should probably ask your practicum or internship site for a different subset of clients, or try to find other ways of getting the experience before you take the test. But I will say this section of the NCE will be more so scenario based, and you'll have more questions that are real world related. Now, there will be some diagnostic questions and some other things that are on there, but for this section, it'll be more so your scenario based questions. So that's it for domain 3 of Post-Grad with Asha, NCE edition. I hope this particular domain breakdown was very helpful and very supportive. And be on the lookout for the sample questions that go with domain 3. And see you next time.